Thank you for having me. So yes, my name's Angie. I'm one of the women's health physiotherapists from Eve Health. And many of you may be wondering what a physiotherapist might do for someone with persistent pelvic pain, and particularly endometriosis. And first of all, I guess most women with endometriosis have more than one cause for their pain. And while surgery may treat the original pain caused by the endo, it won't address all aspects of your pain experience. And often there will be pains and symptoms that remain, including bladder pain, constipation, bloating, adhesions, irritable bowel, painful nerve pathways, muscle spasm, migraines, and so on. As physiotherapists, our aim is to restore normal muscle function, and definitely from our perspective, that is the pelvic floor muscles, like Esme touched on, and of course restore normal functional movement, and that's the principal body function that is often controlled by pain. So just to touch on a bit about pain, generally pain protects us. It alerts us to danger before we're injured. Pain involves all of our body systems. It makes us move differently, think differently, and behave differently, which is also vital for protection and healing. This diagram very much simplifies how far we've come in terms of the understanding of pain physiology. And you can see up in the left-hand corner that in the 16th century, it was thought that pain was felt in the tissues and that message travelled to the brain, and it was very much in one direction. But we now know that pain is 100% an output from the brain. And of course, it's influenced by many other factors like mood, prior experiences, our expectations, and our thoughts and beliefs. When pain persists, the normal danger alarm system in the brain becomes more sensitive, and our mood and thoughts and beliefs and emotions become more involved and start to contribute to the problem. The brain adapts to become better at producing the neurotag for pain, or better at singing the pain tune. And you can probably relate to this if you're singing along to a pop song on the radio, and then days later you can be humming the same tune. And pain can be a little bit like that, where it develops a memory in the brain. So when the brain adapts and becomes better at producing this neurotag, the systems have become supercharged and primed to respond in this way. So chronic pelvic pain or persistent pelvic pain is often defined as pain perceived to arise in the pelvis. And for a diagnosis, it's continuous or cyclically recurrent for 6 months or more. Pelvic pain is very complex because the pelvis is a very special area of the body. We have a lot of crosstalk within structures, and there's a complex network of nerves, which means that a strong signal from one area may stimulate a neighbouring nerve, even though that neighbouring nerve was not being irritated by the original stimulus. And this intermingling of signals can confuse you about where your pain is really coming from, and can lead to many different symptoms, including lower urinary tract, sexual, bowel, pelvic floor, or gynecological dysfunction. I might just skip that one for a sec. As with our pain system, our sympathetic nervous system is also designed to protect us. I'm sure that you would all recognise this as the fight and flight system, like Stacey had just touched on. And this system powerfully and rapidly responds to threat and danger. It releases adrenaline into your body, which diverts energy to your brain and your big skeletal muscles. It increases your heart rate, stands your hair on end, dilates your pupils, constricts your gut, and suppresses immune activity and sexual arousal. So while adrenaline is very useful if you are going to fight a tiger in the jungle or fly away, or you're looking for that big buzz from bungee jumping or skydiving, we don't want it to hang around for too long. And we know that in chronic pain states, this system is wound up and supercharged. It's running on adrenaline, which is not useful long term, and certainly not useful for the healing systems, which you can see on the right, which is our parasympathetic nervous system, or commonly known as the rest and digest system. It's more concerned with slowing and conserving energy. It aids in digestion, the storing of energy, cellular replenishment, healing, and reproduction. This system is more active during sleep, rest, and meditation, and again is often neglected in times of stress, pain and anxiety. I'm going to go back to this slide, and this slide is really useful because it demonstrates how each person's pain picture is individual, and when formulating a treatment plan, it can be really useful to use this map to look at central contributing factors, local contributing factors and regional factors. So just for instance, in the central nervous system, you may have past experiences of painful periods, missed school, multiple laparoscopic surgeries, and then of course, you know, anxiety, depression, and your thoughts and beliefs, like I mentioned earlier. From the local systems, that's much more where we're concerned, where the hypertonic pelvic floor muscles come in, and then irritated and inflamed vulvovaginal mucosa, those sorts of things. And then, of course, regional factors are everything else. So, you know, musculoskeletal conditions like back pain and neck pain, and migraines, and then, of course, bladder and bowel dysfunction like IBS and interstitial cystitis. So you can see how pain can really start to dominate your life, your work, your friendships, your family, your intimacy, thoughts, beliefs, and emotions. So it's important, of course, to address all of the dimensions of the pain experience. So how can we help? There are many strategies we can use to help manage your pain, but I thought I'd just touch on a few of them today. So this is a list of skills that I'd like to sort of outline and hopefully offer you some strategies to take home for your sort of self-care toolbox. So a bit of a lesson in anatomy. I know you've seen this picture before, but it's a simplified version of the pelvis. You can see at the front we have our pubic bone, the bladder that's sitting behind that, the vagina, womb, tubes and ovaries sit above there centrally, and then we have the bowel posteriorly, and of course the sacrum and the coccyx bone at the back. You can see that long sling of muscles, which is the pelvic floor muscles supporting. And of course this next image will show you those muscles in a little bit more detail. So they do provide a beautiful hammock of support for the pelvic organs, so that's one of their roles, to prevent prolapse. The other role Esme touched on, which is to help support and stabilise the lumbopelvic region through movement and load transfer. They play a very important role in sexual function, and of course they maintain continence until, of course, an appropriate time where they relax to enable the passage of urine, faeces and wind. In terms of sexual dysfunction, I wanted to just touch on the study of the mouse and the cheese, and often in persistent pelvic pain and endometriosis we see an overactivity in these muscles. So as we've touched on before, that inflammation in endometriosis can create muscle spasm, which creates more pain, and that muscle pain cycle occurs. So the pelvic floor muscles are very central to that. Some of the problems, including painful intercourse that occur with tight muscles, are obstructed defecation and, of course, dysfunctional voiding. So painful intercourse, yes, becomes a little bit like that study with the mouse and the cheese, where if the mouse gets zapped every time he tries to eat the cheese, then he's probably not going to want the cheese anymore. And that happens at the first sort of instance with intimacy, where the body starts to almost anticipate pain, and those muscles come in and lock down, and that spasm obviously feeds into that pain cycle. Over time, this leads to a decrease in desire, arousal, and orgasm, and of course, sex should be a very enjoyable, pleasurable thing, and it shouldn't be about avoiding pain. So down-training these muscles and sexual function become a really important factor in our treatment. I know Esme touched on breathing, but the effects of the pelvic floor muscles spasming and the tightening of the abdominal wall that we often see in pain does affect our breath pattern, and just in any sort of stressful situation, we often notice a change in breathing, where we often draw in a lot of our accessory muscles, or we breath hold. And so learning to gain control over breathing can be a really effective way to manage your pain, and we'll often teach this technique to patients so that they can use it in response to stress or pain or anxiety. So normally the respiratory system is regulated during breathing, and I know Esme had a beautiful demonstration of that. But as we breathe in, yes, the diaphragm does descend, the abdominal wall muscles should relax, and then the pelvic floor muscles relax. So if we've got tight and overactive pelvic floor muscles, then just purely using that breath awareness can help to relax those muscles. So I do want to teach you that little skill right now. So I will get everybody to try to sit back into their chairs, maybe uncross your legs if you've got them crossed, and sit back so you've got good support for your spine. I'd like everybody to pop one hand on their belly and one hand on their chest. And the hand on your chest is there to monitor for unnecessary movement in the chest, and I'd like you to try to minimise that movement if possible. And as you take a breath in, I want you to feel the air come down into the bases of the lungs and cause that gentle rise in your belly. And as you breathe out, I want you to feel that fall in your belly. So if you can, breathe in through your nose, feel the rise in the belly, and on the outward breath, blow out with pursed lips if you can, just to prolong that exhale. And again, breathing in and out, feeling that gentle rise and fall in the belly. And you can begin to feel how calming and relaxing that technique is for the central nervous system. But it is a skill. It's not an easy thing to do, and particularly not when you're in pain. So use these skills when the pain is whispering at you, not when it's screaming at you, and practice. So you know, take that little skill away and make it part of your daily routine if you can. Okay. So exercise and stretching again, mimicking Esme, but these days our sedentary lifestyles, along with protective posturing in response to pain, like the fetal position, increases load on our nerves, muscles and connective tissues and joints. So again, learning to respond to pain with gentle physiological movement, stretch, and engaging in regular low-impact exercise. So yes, we want you to do what you love, but we also want to encourage you to engage in low-impact safe exercise. So things like swimming, yoga and walking are much better choices from our point of view. And they will help to reduce strain, improve proprioceptive awareness, minimise stiff joints and tight muscles, and help to push back on your pain systems. So we know that muscles like to contract and hold, but they also like to relax and stretch. So I would like everybody to stand up. I'm not going to make you get down onto the floor, as we almost did, but we're going to learn just to stretch each part of our spine. So I want everybody to stand sort of hip distance apart, feet hip distance apart. Just soften through your knees if you can, so that it allows movement through the lumbopelvic region. And our first exercise, you need to channel your inner Beyonce. We're doing some pelvic tilts. So tucking the tailbone under and flicking the tail out behind you. So I'll stand side on so you can see this a little bit better. Tucking the tail under, flexing through the lower back, and then flicking the tail out so you're extending through the spine there. Good. And then if you're feeling really game, I'll get you to do some circles. So just dissociating that movement through the lumbopelvic region and then back the other way. You're really coordinated. Beautiful. And then moving up the spine, we'll do some stretches for the thoracic spine, so sort of mid-back to upper back. So I'd like everybody to pop their palms together, reach forward, feel the shoulder blades reach around the chest wall, and just take your chin to your chest. And then bring your forearms up and together in front. And you might need a little bit of space here, but this is open window stretch. I want you to feel that stretch across the chest as you squeeze the shoulder blades back and together. Good. And just one more of those. Squeeze. Good. And then link the hands behind your back. Pull down. Shoulder blades slide down your back and just lift the hands away from your spine. And that gets a nice stretch across the pectoral muscles and all those postural muscles that get tight from desk jobs and sitting all day. Good, and then coming back up, we'll just do, just before you sit down, we'll just do some neck stretches to tuck the chin in. Take your right ear to your right shoulder, and then just coming back up, chin in again just to protect your joints, and left ear to left shoulder. Good, and before we sit back down, just some shoulder girdle stretches, big shoulder rolls, so shrug the shoulders up, back and down. Beautiful, so that probably comes at a good time to have a little bit of a break, but you can all sit back down. But you can see on this slide that there are a lot more exercises you can do, and much more specific to pelvic pain. But in the interest of while you're at work and when you can't get down to the floor, there's no excuse not to move and stretch. Okay, so many of you probably know that the bladder and bowels are very much affected in endometriosis and pelvic pain. And this can be due to the impact of overactive pelvic floor muscles and, of course, the intimate relationship of the nerves and the crosstalk that occurs between various structures in the pelvis. So learning good bladder and bowel habits is important to minimise strain on the pelvic floor. And here you can see, making sure that we drink enough fluid, no just-in-case visits, allowing enough time to go to the toilet so we don't strain to empty our bladder or our bowels, and ensuring optimal stool consistency. And this is in reference to the Bristol stool scale, and this one is for children, which is a bit more friendly. It's in reference to a lot of different foods, which I don't know if you'll look at the same way after this. But starting from the top, we've got type 1, which is a really hard pebbly poo, and we refer to that as rabbit droppings. And then type 2 is like a bunch of grapes. It's hard again, but lumpy. Type 3 is a bit softer, but still hard with cracked surfaces, and that's corn on the cob. Type 4 is a soft sausage, and that's our ideal bowel motion. So we're looking for a formed stool, but something that's soft and easy to pass. As we move further through the chart, it gets softer. So we're looking at chicken nuggets from there in little soft pieces that break away. Type 6 is like a porridge, and then we're coming all the way down to a gravy. And either end of those scales both put strain on the pelvic floor, so that's why we're aiming for that number 4, soft sausage. Now, another way that we can reduce strain on our pelvic floor and change the way we go is by changing the way we go to the toilet. And this is the defecation position, which I'd like you all to have a go of. I'll just pull this chair out, but we want to try and adopt the traditional method of squatting. And I know there's a lot of countries that still do this, and Turkish toilets and many Asian countries and things. But in our instance, we've got the squatty potty or a footrest to help with that. So by putting your feet onto a footstool, it brings your knees higher than your hips, which sort of simulates that squat position. And then if we can, try and lean forward from the hips and create that curve, or keep that curve in your lower back. So can everyone try this for me? So shuffle forward onto the edge of your chair. And in the interest of not having a footstool, I want everybody to come up onto their toes. And just flick your duck's tail out behind you. So you want to create that little curve in your lower back. Lean forward from the hips and relax the abdominal wall. And I'll get everyone to put their finger into their belly button. Now, instead of straining and bearing down on the pelvic floor, which often we do by tightening the abdomen or the abdominal muscles and pressing down, I want you to swell or expand into the abdomen. So try to increase intra-abdominal pressure by bulging the abdomen out. So we can do that by blowing, like a big balloon belly. So that kind of action. Can everybody try that for me? Yeah, beautiful. Looks pretty good from here. So maybe take a photo of that image and pop it on your toilet door. Remind yourself. Teach your friends and family. Okay, so understanding your pain is really important, and using these smart activities can really help. So managing stress on a daily basis, engaging in plenty of relaxation, reducing stress, engaging in general exercise, which, as I said before, low impact is best, and engaging in mindfulness and meditation. So I'm sure a lot of you can relate to this image. Have any of you been in a yoga class before where you've just got thoughts going in and out of your mind? Because our brains are a little bit like monkeys and they'll jump all over the place if we let them. But meditation and mindfulness is a skill. It's a difficult skill to attain, and it needs practice. So I want to run through a little guided relaxation with you. So I'd like you all just, again, to sit back in your chairs in a really comfortable position, uncross your legs, and you can either have your hands relaxed by your sides or pop a hand on the belly to monitor for your breath. And if you're comfortable, close your eyes. So I'd like you just to start to begin to think about your breath. Breathe into your belly. Feel that gentle rise and fall in the abdomen. And we're going to run through a short body scan. Starting from the crown of the head, I want you to relax through the scalp, the forehead, around the eye sockets, the jaw. Unclench your teeth, relax through your tongue and your throat. Soften through the muscles around the base of the skull, the neck, all the way down to the shoulder blades. Relax and open through your chest. Feel your arms become heavier. Feel your hands and your fingers soften. Relax the abdominal wall and feel it gently rise and fall with the breath. And again, feeling your pelvis become heavier with every outward breath. Feel it sink deeper into the chair. Feel your legs become heavier and feel your feet sink into the floor. Can I get you all to cast your mind to the pelvic floor? Visualise it. It slings from the pubic bone to the coccyx bone and between the two sit bones. I want you to visualise a warming sensation, helping to soften the pelvic organs, the pelvic floor muscles and connective tissues. Visualise a weight sitting in those muscles, helping to weigh them down to stretch them and lengthen them. Again, focus on the breath. Breathe into the belly and with the outward breath, relax the pelvic floor. Again, with that warming sensation, I want you to relax the pelvic floor and continue to relax it almost until it melts off the bone. Again, check in, relax around the forehead, the jaw, the tongue and the throat. Relax the shoulders, the abdominal wall, the pelvis, the lower limbs. And before we come back into this space, I want you to check back in with your breath. Realise and recognise this relaxed state that you're in and try and take it away with you. And I'll get you to start to wriggle your toes, wriggle your fingers as you feel your body become a little bit lighter. And when you're ready, you can open your eyes. And hopefully, if you're not asleep, you'll be able to drive home. So yes, I'm just going to quickly touch on the women's health services that we offer at Eve Health. So Alex Diggles and myself are the two women's health physiotherapists at Eve Health, and we really encourage you to seek help early, because it does make it much easier when we're looking at correcting motor changes and providing pain strategies for you. We don't require a referral, so and you don't need to be seeing a gynaecologist at Eve Health. However, we do have two of the very best endometriosis gynecologists there, including Dr. Susan Evans and Dr. Michael Williams. We also support the team care arrangement via your GP, and of course we provide private health rebates. Physiotherapy in women's health has an added advantage of being supported very strongly by the evidence. So, and to treat many different conditions, including pelvic pain, sexual dysfunction, bladder and bowel dysfunction, urinary and fecal incontinence, pelvic organ prolapse, and of course for pre and post-op gynae care. So you can expect from us an array of different modalities in terms of treatment. I have touched on this before, so I'll just flick through there. We offer a long initial appointment, so we do have the time to listen to your history and provide support. There's no wait list currently, so there are appointments available Monday to Friday, so please call us today. And we've just got a list of useful resources and things if you'd like to access them for further reading. Thank you very much for having me, and all the best in your journey.